मॅडम सुगंध तर इतलो बरो येता जाणा.
थँक्यू.
टिफिना वांगडा त्यो न्यूट्रिशनाच्यो गुळयो दिवपाक विसरू नका हा.
आता तू न्यूट्रिशनाच्यो गुळयो विसर.
कित्याक?
का या तांदळातूच सगळे न्यूट्रिशन मेळटले. पंचामृता फोर्टिफाईड राईस हातूंत आयर्न, झिंक, फॉलिक ऍसिड, व्हिटॅमिन ए, बी सारकेले 9 मिनरल्स आसात. तर हे झाले नाही निरोगी आणि सुवादिक. तर पुराय पौष्टिक आहारा खातीर
पंचामृता फोर्टिफाईड राईस
असल्यास पुरो.
पुराय पोषणा खातीर पंचामृता फोर्टिफाईड राईस. घराघरांनी पंचामृता.
नमस्कार. प्रुडंट मिडियाच्या हेलो दोतर कार्यावळीन तुमकां सगळ्यांक मनाक काळजाचो उपकार. दिवाळेचे दीस आसा. दिवाळेचे दीस आमी खरें म्हणजे बरे सेलेब्रेट केला आनी अशा वेळार भुरग्यांची काळजी घेवप खूप महत्वाची आसता. आनी एक थोडोसो प्रयोग असो म्हणूं येता की आमचे बरोबर आमकां एक नवी वळख करून दिवपा खातीर होमिओपॅथी कशा पद्दतीन ल्हान भुरग्यांच्या दुयेंसांनी काम करता हाची आमकां पुराय विस्कटान म्हायती करून दिवपा खातीर आज स्टुडियोन आसा डॉक्टर डॉर्लंड मार्टिन्स, जे 20 वर्सां गोंयांत प्रॅक्टीस करतात. नामनेचे तज्ञ आनी डायनॅमीक डॉक्टर अशें म्हणूं येता. आनी दुसरो म्हणजे जसो हो विशय मातसोसो एक कारण आज कशें आसा, आज आमी जेन्ना आयुष ह्या विशयाचेर जेन्ना उलयतात तेन्ना माननीय प्रधानमंत्र्यांक अशें जाय की आमचे होमिओपॅथी, आयुर्वेदीक आनी हे सगळे जे आमचे बाकीचे जे हे आसा म्हणजे अपार्ट फ्रॉम मॉडर्न मेडिसीन ह्या सगळ्यांक एक्सपोजर मेळपाक जावो, लोकांक तांचो फायदो जावपाक जावो आनी ताच्या खातीर देशान सगळ्या लोकां पर्यंत ही माहिती पावपाक जाय. हो जो तांचो जो विचार आसा ह्या विचाराकूच फुडें धरून ह्याची कार्यावळ फुडें वता अशें म्हणूं येता. डॉक्टर वेलकम. नमस्कार.
नमस्कार.
सगळ्यान जेन्ना पयलीं आमी उलयता की होमिओपॅथीन चायल्ड केअर हो आयचो विशय म्हणजे होमिओपॅथी ल्हान भुरग्यांच्या दुयेंसां मदीं कशें कार्यरत आसा किंवा कशा पद्दतीन काम करूं शकता. तेन्ना सगळ्यान पयलीं जे लेट्स टॉक कारण आतां मॉडर्न मेडिसीन म्हणजे एलोपॅथीक मेडिसीन सगळ्या लोकांक खबर आसा की बाबा ही जोराची गुळी ही घेतल्यार जोर देंवता, ही एंटीबायोटीक ही घेतल्यार लागता, हे अमकें मलम हे लायल्यार घावो बरो जाता. बट होमिओपॅथी वर्क्स इन सर्टन डिफरंट प्रिंसिपल्स दॅन दीस. सो वॉट आर दीस म्हणजे हाजे पयलीं आमकां होमिओपॅथी म्हणचें कितें किंवा ताचे सो कॉल्ड कार्डिनल प्रिंसिपल हाचे मातशें विस्कटून सांगा.
See, basically, homeopathy कितें आसता? It is a therapeutic system of medicine that is based on a law of cure called similia similibus curenta. So when you go and आमी वेदांत आसता, there are two basic principles of cure. One is the law of entities and one is the law of similars. So जेन्ना patient येता, we generally try to explain to them a basic concept as to what do they understand by law of entities and law of similars. For example, if you are feeling cold, okay, thandi lagta, and you want to feel a little warm, you might want to go and have a warm water bath.
Absolutely.
Exactly the opposite of what you're feeling.
Correct.
Gelo, nowlo, you feel good for some time.
Correct.
There is a slight relief, but once you come back out, you'll feel double cold. Because your body reacts and gives you a feeling of more sensation of cold. That is law of entities, opposite. But when it comes to law of similars, suppose you're feeling cold, you go and have a cold water bath. Initially, there's an aggravation. That's why people say initial aggravation zata. But once you come out of that cold water bath, you start feeling hot because the body has reacted to that cold water bath.
Acha.
So homeopathy is based on a system of similars. So what do I mean by similars? You have different remedies in homeopathy which are tested on healthy human beings. You give it to healthy human beings. Kite symptom produce jata. We note down all the symptoms of each remedy in detail on different in males, females, kids, and then we get a drug picture. Whenever we get patients who come with a similar drug picture, we got to match it.
Acha.
So it's like a lock and key. You use the right key, the lock is bound to open. Use the right remedy, the case is bound to get cured. So that's what it is based upon.
It is like complement. जसे म्हणजे 7 लिव्हर लॉक असतात तुम्ही म्हटले की त्यातून 7 लिव्हर जेन्ना ताचे भितर कॉम्प्लिमेंटरी भितर वतले तेन्नाच ते लॉक ओपन जातले.
Correct.
अदरवायज म्हणजे तुम समज 4 ताचे सॉकेट्स भितर गेले जाल्यार ते ओपन जावचे ना. सो यू हॅव टू हॅव एवरीथिंग मॅचिंग. सो यू प्रोड म्हणजे तुम्ही पयलीं तसो अभ्यास करता की बा हे वखत खंयचे सिम्पटम्स प्रोड्यूस करता. त्या पद्दतीचे सिच्युएशन आशिल्लो मनीस जेन्ना तुमचे कडेन येता तेन्ना तुम्ही यू थिंक दिस इज अ रायट मेडिसीन फॉर दॅट एंड इट इज मॅचिंग. करेक्ट.
Correct.
So according to you, also mechanism of action almost similar असतं कारण I'm just giving example because I'm not so much familiar with you. आता आमच्याकडे किती असतं आता वॅक्सिन्स दिता आम्ही केन्ना आम्ही सो अँटीबॉडीज प्रोड्यूस करता बॉडीन आणि इज इट मेकॅनिझम तुमची तशीच असता काय तुमची आणि किती पद्धत असता जस्ट फॉर क्युरियोसिटी
See, you've got to realize that every individual is born with a healing capacity.
अच्छा राईट
So every time the body is always trying to cure and help you. So what do I mean by that is whenever you got qualities like the body will always try to protect, it will create or it will destroy in the process of cure. So for example, if you're wearing a tight shoe, okay, the first thing that the body will try to do is cause you inflammation, there will be redness जातले, swelling जातले, सुस्तले. If you still continue wearing the tight shoe, the next process by which it will form a hardening, thickening of the layer, and the last part of it is where it will form an ulcer if it is untreated. घाव जाता. So whenever patients come to us, okay, we try to explain and sit with the patient's parents, and we try to explain to them as to what are the innate characteristics of healing. For example, a lot of patients come to us and they say, "Bhitate zor rehta." They think fever is the cause. Fever is just the reaction to kill the bacteria, to kill the viruses. Similarly, naak vaunta. Okay, you've got to understand naak kitya vaunta.
Correct.
Whenever there is any allergen, whenever there is any bacteria, viruses entering into the system, the first thing that the body is trying to do, throw it out. So mucus secreting glands will secrete mucus.
Correct.
It will trap the organism and it comes out in the form of runny nose and sneezing.
Correct.
What do patients generally do? They may generally use nasal drops, nasal spray, and they'll dry up the first response. So once you dry up the first response, the bacteria, viruses get into the lower respiratory tract, starting with coughs, colds. You take cough mixtures, cough syrups, and then after a few years, the child will end up into asthma. Similarly with fever, we have seen over the past so many years of practice, I've seen patients, the lesser they take paracetamol, crocin, allow the fever to run. The faster is the cure.
Oh.
Why? Because you're giving the opportunity for the body to kill the bacteria, kill the virus. The higher it rises, the bacteria cannot divide, viruses cannot divide. But आम्ही crocin घेता before just 99 झाले crocin केले बिले, you bring down the temperature of the body and then the viruses, bacteria get further to chance to divide and such infections last for a pretty long time.
So basically this is like a first line of defense. म्हणजे body is having its own defense mechanism आणि जेन्ना एखाद्या अशें सिच्युएशन जाता की बाबा कित्याक लागून जोर आयलो जाल्यार जोर येवप हें अशें चिन्ह आसा बेसिकली इट इज अ बॉडीज डिफेन्स मेकॅनिझम इज कमिंग टू पिक्चर सो दॅट यू आर प्रोटेक्टेड फ्रॉम दॅट ऑर्गॅनिझम जशें कित्याक फॉर एक्झाम्पल तुमी एक्झाम्पल सांगलें की जशें नाकान कितें तरी गेलें किंवा समजा दोळ्यान कितें तरी कुसकूट गेलें धूळ गेलो जाल्यार दोळ्यांतल्यान दुखां येता म्हणजे बॉडी इज वॉट ट्रायंग टू एलिमिनेट ताका तो भायर उडोवपा खातीर दुखां येता जर आमी तो दुखांच बंद केली जाल्यार इट वील रिमेन इनसायड बिकॉज दॅट यू वोंट हॅव एनी म्हणजे तुका डिफेन्स मेकॅनिझम इज नॉट कमिंग टू पिक्चर. And according to you or your system, body using its own defense mechanism is better than rather than pushing something else to do that same job.
True.
So because you are putting your own body and your body knows what is exactly right for you. Correct?
Correct.
Yeah.
So it similarly happens even when you eat something bad. The first thing the body is trying to eliminate the bad thing, try in the form of loose motions.
Absolutely.
But it has to be controlled.
Yeah.
As a doctor, my basic idea is to see that the reaction of the body is within control. And as long as it's within control, the patient will get well very fast. Especially we have seen this after COVID. After COVID, parents generally want this. They come saying that they want to improve the immunity of the child. Immunity became something after COVID. Everybody was talking about immunity.
Correct.
So it was from soaps, hand washes. It was from atta, biscuits. Everybody was promoting saying that they're increasing immunity. That's going to help in immune system building up.
Correct.
But immunity doesn't develop like that. Immunity develops only when the immune system, it's like a muscle. The immune system is allowed to react with the bacteria, viruses, and only when that interaction happens, it's then when antibodies form jata. And these antibodies remain for life. That's how you build the immune system.
So basically, in fact, just to add, like say nowadays even for cancer treatment, they say like immunity also should be increased. It is just not a chemotherapy, giving chemotherapy agents is not a solution. Immunity also should be improved so that the body itself can fight with that organism or with the situation and have its own defense mechanism come into play as a first line of defense.
Correct.
Yeah.
It is absolutely correct that the immune system plays a huge role in protecting everybody from any illness. For example, we must have, as children, we must have seen a small prick. If a thorn remains in, you're playing in the garden, a thorn remains in, what will generally happen? There'll be swelling, there'll be inflammation,
Correct.
redness, pus from
Pus
jata,
forms.
and then the thorn is thrown out.
Correct.
It's the way how the body reacts. So many a times kitne jata, we try to suppress this innate immune system. We try to suppress it, and hence diseases get prolonged and remaining for a longer period of time.
So according to you, ही जी डिफेन्स मेकॅनिझम आसा ताचेर चड भर दिवपाचो रादर दॅन रोखडेंच कितें जालें की समज एक दोन शिको आयलो की रोखडें एक कशी तरी गुळी घेता की तातूंत ते शिको थांबयता किंवा दोळ्यान कितें पडलें किंवा जशें सी दिस इज नॉट अ प्रॉपर वे ऑफ थिंकिंग रादर दॅन दॅट लेट द बॉडी कम इन टू पिक्चर अँड वेन द थिंग्स गो आउट ऑफ कंट्रोल म्हणजे तुम्हाला समज सामकेंच अशें म्हणना तुमी की बाबा जोर येता 8 दिसांनी तुमी तशें राव अशें न्हय इफ इट इज गोईंग आउट ऑफ कंट्रोल लायक सी इवन लूज मोशन यू हॅव मेन्शन कितें तरी तुमी खाला आसतलें ताका लागून लूज मोशन जाता की बॉडी इज ट्रायंग टू एलिमिनेट पण रोखडेच तुम्ही ते टॅबलेट घेऊन बंद करू नकात किंवा आम्ही खूप फुडें कितें करता कितें तरी गुळी घेता आनी ते थांबयतात दॅट इज नॉट द करेक्ट वे ऑफ थिंकिंग अकॉर्डिंग टू युअर प्रिंसिपल्स एम आय रायट
Extremely.
डॉक्टर या नाव आय गॉट वन मोर वेरी इम्पॉर्टंट क्वेश्चन इज दॅट वॉट इज द स्कोप ऑफ होमिओपॅथी इन चायल्ड केअर बिकॉज युजली चिल्ड्रन म्हणजे तुम्हाला खबर आसा न्ही आता हांव कित्या खातीर स्पेशली म्हणटा स्पेशली बिकॉज आय डोंट नो वेदर हाव विल पुट इट आता जाणटो मनीस पयलीं म्हणजे होमिओपॅथीची दॅट इज अ बिलीफ की होमिओपॅथी म्हणजे एक्यूट इलनेसाक आता नाव डेज यू आर सेईंग बट अदरवायज पीपल म्हणजे अशें फिलींग आसा की क्रॉनिक इलनेस लायक एज यू से मेन्शन अस्थमा आसा किंवा आनी कितें स्कीन प्रॉब्लम जाल्यार ते घेवं येता बिकॉज यू ऑल्सो हॅव टू टेक अप फॉर अ लॉंगर टायम रोखडे रिलीफ मेळना असो एक समज आसा समज काय गैरसमज यू वील बी बेटर पोज सेकंड थिंग आता खंयचें मेडिकेशन भुरग्यांक दिवप म्हणजे ते पयलीं 4 दीस घेतले मागीर ते घेवपाक वाजें येता किंवा वॉट एवर इट इज सो ह्या सिच्युएशनान वॉट इज द स्कोप ऑफ होमिओपॅथी इन चायल्ड केअर इफ यू इन लिटल ब्रॉडर सब्जेक्ट बट आय वॉन्ट यू टू कवर दॅट
The need of the hour is education of parents.
Good.
What is right and what is wrong. Understanding when the body is healing and when the body requires an assistant of a doctor. As a doctor, I personally feel the doctor who gives the least medication
Absolutely.
is the best doctor.
Absolutely.
Many a times you get patients say, "Are kains dena," because they do not understand that least medication is something that's the most useful for a patient. So we sit across with patients and we try to meet each parent we try to make them understand as to what are these processes and when to wait and when to medicate. The first and most important thing whenever a patient comes to us is how is the patient today as compared to yesterday. How is the intensity of cough today as compared to yesterday. How is the loose motion today as compared to yesterday. So if we see a change in the frequency, for example, if today she says that no, today आज cough मातशें कमी आसा या लूज मोशन काल 10 पाटी जाले आज फकत 5 पाटी जाला. So in such conditions we know that the body is taking care. That's why it's decreased and even without medications it will heal. So in such conditions we avoid any kind of medication. Our main goal is just to see that the patient doesn't get worse.
Correct.
If we understand that the body is healing, then we just allow the body's own immune system to take care of it. And what is the main intention of it? The main intention of it is so that the bodies create antibodies. The immune system creates
Correct.
antibodies that will remain for life.
Yeah.
कितें जाता otherwise what do we see? कितें जाता की sometimes patients थंडी पोतून थंडी जाता. And then they say they cannot have ice creams, they cannot have cold stuff, they cannot eat grapes and all. And for them it is healthy. But is the patient healthy? As a child, we want a child to have ice cream, we want a child to have grapes, bananas. And this can only be improved if they are put on long-time homeopathic treatment. So we see that the immune system gets built so that later they can have these things without any complications or without any episodes of cough or asthma, things of that. So basically we try to build up the immune system for the future.
So basically, yeah, this is very good. म्हणजे जसे तुम्ही आता सांगले की we also say that the best surgeon is the one who knows when not to operate.
True.
So nowadays also now we have got laparoscopy surgery. Once upon a time we used to say like so many इतके पोत पडले म्हणजे व्हडलो दोतोर आणि व्हडले ऑपरेशन. Nowadays the things are changing. Now लहान बुराक आणि व्हडले ऑपरेशन कॅन बी डन. सो इट हॅज रिवर्स द सिच्युएशन. जसे तुम्ही सांगले की डॉक्टर इवन होमिओपॅथ नोज वेन नॉट टू गिव्ह मेडिकेशन ऑर मिनिमम मेडिकेशन. सो ज्यांना बॉडीची डिफेन्स मेकॅनिझम हॅव ऑलरेडी कम इन टू पिक्चर अँड इट इज प्लेइंग इट्स रोल वेल, देन देर इज नो नीड टू इंटरव्हेन मच. म्हणजे ते आपलं ऑलरेडी काम त्यांनी सुरू केलं. पण समजा बाबा ताका सपोर्ट सिस्टम जाय, मे बी दॅट इट मे रिक्वायर. बट तुम्ही आनीक सांगितलं म्हाका पॉयंट आवडलो की भुरग्यांनी भुरग्यां भशेन वागपाक जाय. देशी म्हणटा तांकां आयस्क्रीमूय खावपाक जाय, ग्रेप्सूय खावपाक जाय, केन्ना मातशें खेळपाक जाय, मातयेन खेळपाक जाय, पावसान भिजपाक जाय. ऑल दीस थिंग्स यू कॅनॉट से दॅट तू केन्ना अशें एवरीथींग इफ यू ट्राय टू रिफ्रेन देम फ्रॉम गोईंग इन टू आउटर एटमॉस्फियर, दे वील बी जस्ट लायक म्हणजे मशीन्स वीच इज नॉट अ दिस थिंग. सो तांचे भुरगेपण तशेंच दवरून तांकां ह्या सगळ्या सुंदर गजालींचो आस्वाद घेतनाच हळूहळू आपली इम्युनिटी बिल्डअप करून त्या पद्धतीन ते रेजिस्टन्स वाडोवन त्या सिच्युएशनाक फेस करप इज युअर मोटो. करेक्ट?
It's absolutely right. What happens is parents think that if they keep them in a sterile environment,
Correct.
they'll use hand washes and all, that the child will become healthier.
Yeah.
But we cannot keep a sterile environment.
Yeah.
And if you try keeping a sterile environment, your immune system can never come across bacteria and virus. Hence, we tell parents, allow your child to play, let them go into water, let them go into dust, let them climb trees, let them fall, because it gives enough opportunity for the immune system to react with the external environment, and hence it forms antibodies. Hence you generally see children, the firstborn child, when parents are very, very skeptical or they're very protective, they don't want to, do not go to play here, do not go into the dust, and their immune system comes down. And they fall repeatedly sick.
Correct.
But when they get the second child, he goes out with the first one, Inga Baunta, Tinga Baunta, and he becomes a stronger child with the health as compared to the first one. Correct. So this is a basic things that we generally tell parents, like allow them to play, give them a chance for the body to react with the external environment.
Yeah, in fact, it just reminds me of a small thing like one boy is asked, what is your name? He said, my name is Daunt. But no, he said, my name is Raju, but they call me Daunt. So what is this? So because every time I don't do that, Don, he start thinking that his name is Don. So it is that way. His name is Raju, but they call me Don. So see, it is like that. So according to everything should be enjoyed. जसे तुम्ही सांगला की भुरग्यांनी सगळे जे गजाली असतात आणि स्पेशली आय टेल यू इवन देर इज अ रिसर्च स्टडी खूप लोकांक कितें संवय आसता की घरा कडेन म्हणजे आय एम नॉट से इट इज बॅड पण प्रत्येक फावटी मातशें कितें जालें म्हणजे दिसाक 2 फावटी कसले तरी एंटी हें घालप म्हणजे वॉट एवर इट इज जे अवेलेबल आसा ते घालून जमीन पुसप परत परत साबण लावन हात साबण सादो साबण न्हय म्हणजे वॉट एवर आय डोंट मेन्शन दॅर नेम्स ब्रँड नेम्स पण हे सगळें करपाना तुमी कितें जाता जे भुरग्यांची इम्युनिटी पिक्चरान हाडपाकच दिनात. एवरी टायम यू कीप ऑन सप्रेसिंग दॅट इज नॉट अ रायट वे ऑफ थिंकिंग. आणि इवन थोडे लोक आतां कितें सी धुवपाक जाय डस्ट पडटा एग्रीड बट अशें प्रत्येक गजाल म्हणजे टू बी व्हेरी फ्रँक आय शूड नॉट प्रमोट दीस बट आय एम जस्ट सेइंग वी आर द चिल्ड्रन हू ग्रो विथ द आमी ते न्हंयचें उदक पिताले टू बी व्हेरी फ्रँक. आमचे कडेन कितें शेताचें ते बांय आशिल्ली शेतांतलें उदक ते कोण आमचे लाट आशिल्ली ते लाटेन काडटाले तेच उदक पिताले. that time that all these packed bottles in fact always आम्ही हे कोण घेतलो आणि आता इनफॅक्ट वी ऑल्सो आम्ही पहिले ते पॅक आणि हे सगळे आम्ही पिताले मातयेन खेळटाले पावसान भिजताले ऑल दीस थिंग्स वी ग्रीव अप विथ. सो आय डोंट नो वॉट इज सो यू आर द बेस्ट जज म्हणजे म्हाका हाचेर कांय कमेंट करपाचें ना लोकांक अशें दिसपाक जायना बट दीस वॉट दे आर मिसींग. आनी आजकाल कितें जालां डॉक्टर तुमी म्हाका म्हणटात पण कितें जालां सगळे जनरेशन इज फूल इज ऑन द मोबायल बिकॉज दॅट इज नथींग दे प्ले दे आर एक्सपर्ट्स in playing on mobile, nothing on the outside. म्हणजे फायल्यार भुरगे आतां see there is a moment in Delhi and all they said please bring your children to the ground, please bring your children to हे आता सिस्टम सुरू करची पडला. अशा सिच्युएशनान आय थिंक वॉट यू आर फिलिंग वॉट युअर कन्सर्न इज रियली रायट. डॉक्टर आनी एक म्हजो प्रश्न आसा की खूब फावटी देर आर लॉट ऑफ मिथ्स सो बिकॉज नाव आय डोंट नो हाऊ मच टायम वी आर लेफ्ट बट कॉमन मिथ्स आसात की एक लॉंग ड्युरेशन लागतले होमिओपॅथीचे टॅबलेट्स किंवा रिस्ट्रिक्शन्स खूप असतले डायटरी रिस्ट्रिक्शन्स असतले. इन शॉर्ट यू कॅन वॉट एवर यू फील अँड वॉट इज राईट अकॉर्डिंग टू युअर लाईन ऑफ थिंकिंग यू कॅन जस्ट ॲड्रेस.
With dietary restrictions, there is nothing much that we generally tell to restrict, especially in kids. The only thing that in homeopathy is something that's very restricted is use of external ointments. For example, if children come with skin-related complaints, eczemas and all, we do not allow to apply ointments, medicated ointments on the skin, because even any skin ailment is an internal disease which is expressing out at the level of the skin. Okay, so kita jata people generally patients make use of ointments, it goes off. stop using ointments, it comes back again.
Barabar.
Just telling you that it is not an external illness, it is something that is internal. So in such conditions, we only give internal medicines. We do not give ointments. We do not give lotions. Anything to apply for the externally. If it has to heal, it has to heal with the internal medications. That's one thing.
Yeah.
Another myth, something is what parents generally do is they generally go outside to a pharmacy and they tend to self-medicate.
Correct.
You get a lot of patented homeopathic medications and they think that's homeopathy because they're picking up the medication from a homeopathic pharmacy. But for something to be homeopathic, we need to match. As I told you, it's based on similar curenta. So the patient's picture has to match with the drug picture. Only when the two of them meet together is when you will get a cure. For example, for a homeopath, if somebody has got cold, for example, just a runny nose, what color is the discharge? What increases the discharge? How did he get it? Did he have something cold? Did he go into a cold atmosphere? All that differs and helps us to differentiate one patient from another patient. How is the child during the sickness? You'll have some children who are extremely cranky. There will be some children who do not want to go to school. There will be some students, even after they are sick, they are extremely studious. All these small points help us to differentiate one child from another and one drug from another drug, which doesn't happen if you go over the counter and get a homeopathic medication.
Correct. So in short, this is like a tailor-made medicine. म्हणजे प्रत्येक मनशा खातीर खंयचें वखद ताका योग्य हें ठरयल्लें आसता. We just cannot go over the counter. म्हणजे ना आपल्याक जशें आमी खंयचें कॉस्मेटीक घेता तशें ना हें वखद दी. आणि often what is another important, doctor, they feel की homeopathic medicines or ayurvedic medicines are safe and there is no this thing म्हणजे ताचे काय side effect आहे ना. So they tend to go for self-medication and that's what even other also people nowadays are become over smart. I don't know why should I say whether they are over smart, because there is something called as WhatsApp University, and that WhatsApp University keeps on telling you just one good thing, you ask for anything, sneezing also, and last statement, it can be cancer or you can die. So that is one, sometimes they get scared. But people using this technology and then self-medication, as you rightly said, like see, no, now today they have heard the program, say, okay, like homeopathy medicine, good for health. Okay, the gara gelo, sneezing. What are the homeopathic medicines for sneezing? Shekurun घेवप is not a right medication, right way of thinking. So please, म्हणजे एक moral of the story सामको लक्षात दवरा, जेन्ना तुमकां एका homeopathic doctor consult करपाचो आसा किंवा homeopathic medicine घेवपाची इच्छा आसा, go to a doctor, whether it is homeopathic or even ayurvedic. It just cannot go over the counter because everybody's prakriti is different, as you also rightly said. की ह्या गजाली प्रमाणे ताका केन्ना थंडी जाता, खंयच्या वेळ जाता, ताका नाकांतल्यान कसो वास येता, एवरीथिंग इज काउंटेड आनी त्या प्रमाणे मेडिसीन ठरता. जस्ट नॉट ओवर द काउंटर गेलो खंय जेन्ना हें म्हणजे समटायम वॉट दे हॅबीट इज लायक ना माय एल्डर सन ऑल्सो फील्स बेटर विथ दीस, सो नाव यंगर सन विल ऑल्सो फील बेटर, ऑर ना म्हाका दिलें तें वखद घेता तूं म्हणजे खोकले हातून थांबले तुजी थांबतली. So that is wrong thing. And one more thing I just want to add. Sometimes they feel that pediatric group means they are like 1/4 or half the adult. See, like say, we have mentioned about paracetamol tablet. Examples from my side. Like see, if you are giving 500 milligram of paracetamol for fever for me. So my son is suppose 12-year-old. What I break the tablet and make half. If he's 6 years, then I make a 1/4. So it is not 1/4 or half of me. So every medication is judged, and in fact, even allopathic medicine we give as per the weight. So everything is counted. It's not just म्हणजे अर्धी गोळी केली म्हणजे तो pediatric झालो किंवा पाव गोळी केली म्हणजे. So it is not 1/4 of the adult or half of the adult. So what is your take on this?
When it comes to homeopathy, for example, a simple example that you have told for sneezing, for example, in homeopathy there are around 500, 600 medications just for sneezing.
Oh.
So from that group of around 500, 600 to come down to one is the aim of every homeopath. And how do we come down to one is by asking a lot of questions. When is it aggravated? When is it ameliorated? When is it better? When is it less? What caused it? How is the patient's behavior during sickness? All that we count and then we come down to one remedy. Is what's the aim, what we plan of doing?
Okay, now simple basic type of question, like doctor, what is the age like when you would recommend starting homeopathic treatment, if at all required, or if the person thinks, okay, I want to go for homeopathy, would you start like right from the beginning or from the birth, or what is your recommendation?
I always say parents should start as early as possible. Generally parents look at everybody looks at homeopathy as later on.
Correct.
आम्ही सांगता की when everything fails, then we
Absolutely.
look for one. But I always say start it early. And why do you start it early? Because there's always a process in which disease follows. For example, in kids, nobody's going to come to you with asthma. Nobody will, as a child, nobody will directly come to you as soon as he's born saying asthma zali.
Borobar.
Now, the first and the most important thing that generally we see in kids is they'll come saying that there is itching of the body, nappy rash, or there's some kind of skin related complaint. They make use of ointments, they suppress it. They stop using ointments, it comes back again. Again they'll use ointments, again they'll suppress it. Till a time comes when the body realizes saying that you're not allowing to throw the toxins at the level of the skin. Where can I throw it next? Next, you'll start sneezing, runny nose, sneezing, runny nose. You make use of nasal drops, nasal sprays. This gets better. It goes into the lower respiratory tract. Frequent coughs, frequent colds. You're on heavy doses of medications, cough mixtures and all. This gets better. Then it goes into asthma. So you try to treat asthma, child goes into maybe breathlessness, joint complaint. So what happens is from birth, the disease is being shifted from a less important, that is from the level of skin, to something that's more important, more internal, something that's can
More
cause
like
more serious conditions. So we try to explain parents ki what do we expect, okay, so that they do not go into such severe complications later on. So it's always better to consult us early, because what happens is the parents and all live in a lot of fear. Bhita dotrak.
Correct.
And you put a slight fear and slight zor, they're scared. They do not know what to do. So it's basically to understand, make them understand as to how is the body reacting to the situation. Whether you need to just live it, it'll heal, or you need to medicate it is something that we do.
Sometimes, as you said, time is the best healer, or catch them young. So हे सगळे गोष्टी मनात धरून मुद्दाम दोतोर तुम्ही स्टुडिओत, आय नो दॅट यू आर अ व्हेरी बिझी प्रॅक्टिशनर, तरी तुम्ही स्टुडिओन आयले आणि एका मोलादीक अशा वेगळ्या विशयाकडे आज आम्ही उलयले आणि म्हाका दिसता ही माहिती जे सगळे तुम्ही ऐकतात तांच्या खातीर महत्वाची आसतली. त्याचप्रमाणे एक नवो विषय तुमच्या खातीर आम्ही ओपन केला, त्याच्या विशीं तुमकां थोडी माहिती मेळची. इट इज जस्ट दिस लायक बेसीक म्हणजे अशें आमी जस्ट फंडामेंटल्स ऑफ होमिओपॅथी बद्दल उलयल्या. दुयेंसाचे आनी कशा पद्दतीन तुमचे व्हॅल्यू आनी हेल्प करूंक शकता हें तुमकां बरें कळटलें. सो आयचे कार्यावळी सोंपतना डॉक्टर काळजांत देव बरें करूं. नमस्कार.